Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, welcome to the Pharmacy Leaders Podcast. Kimber Boothe is with me today. She's a pharmacist, healthcare leader, and entrepreneur. Her diverse background includes patient care as a clinical pharmacist and leadership roles in health systems, the pharma industry, and academia. She's currently system director of pharmacy at a 4-hospital health system and is founder and CEO of Kimber Boothe Group. She provides coaching, consulting, educational programs, and speaking. She calls herself a connector and pharmovator and is passionate about spending time on the right things to develop others and deliver strategic, focused results. Welcome to the Pharmacy Leaders Podcast.
Thank you. It's great to be here.
Well, I wanted to get a little bit of an idea of your background and kind of where you came from, and then we can kind of talk a little bit about where you can help other people go. So where did you start your pharmacy career? And then tell us a little bit about how that led to helping others with theirs.
Oh, great. Yeah, so, way back when I was in high school and looking for careers, I chose the profession of pharmacy because of my close relationship with my own community pharmacist. Unfortunately, I was a patient with asthma at that time. And from there, went to the University of Connecticut for my bachelor's. Had to go elsewhere to finish my PharmD. I did that at the Medical University of South Carolina, and then did my residency programs, PGY1 and a PGY2 in internal medicine at Virginia Commonwealth University in Richmond, Virginia. From there, I returned to Connecticut to work at Yale New Haven Health. I was a cardiology critical care pharmacist. I started in that role and then became a specialist, starting a P&T committee, and had a wonderful time. I was really enjoying it. And then for personal reasons, an opportunity presented itself for me to move to Florida to be near my father. And at that time, I took a position with Bayer Healthcare. And I started with Bayer at that time as a medical science liaison, and then moved in-house to their headquarters in New Jersey at the time that I got engaged and was getting married. And from there, I had various roles of increasing responsibility in medical affairs, research, publications, advisory boards, and the research was phase 4 and investigator sponsors type studies. And so I enjoyed that. And then about 3.5 years ago, I was working with my own coach that I had received through the Women Unlimited network, where I was doing some leadership development, and working with that coach and really understanding what my passions were. I decided to leave pharma, which I know a lot of people don't do, but I was really passionate about getting back to direct healthcare, doing something with health IT. And it was at that same time that I started the Kimber Boothe Group and realized that, I saw a need for people to receive coaching. A lot of professionals, they spend a lot of time on the science and developing those skills and not so much on the leadership, mentoring, the softer skills, and even the finance and business. So I saw that people were not connecting the dots. So that's why I started that business, but I wasn't quite ready, to do that full time. And so I ended up taking an opportunity to be the director of clinical services back at Yale New Haven Health, where I had worked previously. And that role was wonderful. I really enjoyed it and had a chance to tie my passion with health information technology, optimizing our use of the electronic health record to improve patients, and really added and expanded the resources that we had in pharmacy for that area. More recently, I relocated for family reasons to Cincinnati, Ohio, where I had the opportunity to take on this more higher level leadership position to be the system director. I know I'm going on in a lot of detail, but it's been a lot of fun. And what I did last year was I was actually attending the Metapreneurs Conference, and in the fall, last spring, and that comes up in April. And that really helped me to refocus my business goals. I really was more general before in terms of how I was coaching and who I was working with and the courses I was creating. But I wanted to tie it back to pharmacy and the successes I was having with adding more positions. And so that's why I've really focused in the past year on supporting pharmacists and technicians in growing their roles.
So you stepped out of your zone of genius and came back to your zone of genius. I can't remember his name. I know Alex Barker uses that phrase, and I know it came from a book that was pretty famous. But so you came back into this zone, and now you have kind of a client group. What kind of, it's not just, hey, I'm a pharmacist, I'm somebody that would be appropriate. What is really your focus in terms of the specific characteristics or their jobs, or is it career transition? What did you end up kind of narrowing this focus to?
Well, most of my focus, because I've had a lot of successes in health systems and pharma industry, is working with people in those areas. And the course that I've created called Pharmovation is definitely targeting pharmacists and maybe technicians, but probably pharmacists in early to middle careers who really want to grow within that company and to be more strategic with their career and their job, to be able to have more pharmacists justify more roles. Because what I'm really trying to do is I want to help the pharmacists, but I also want to make sure that we are able to achieve our larger needs and goals of solving these horrible medication use problems that we still have in the U.S. You know, we are the experts, and I know there's a lot of concern and negativity out there with some of the things that are happening in our industry. And really my goal is to help people to stay motivated, stay encouraged, because one of my big mottos that I preach to everybody I can, and even to senior leaders, is pharmacy can do more with more. We need to be able to grow our careers, grow our roles, and take advantage and manage the patients that are in need in this country as the medication experts that we are.
Well, many people are finding out about the residency next Friday, and whether they're going to get to do a residency, but there's also a lot of people that are finishing their residency in 3 months. And I think some of them have maybe taken on roles within their own hospital, and some have, taken on roles, wherever they ended up going. But what do you say to the one that may be still looking, that's in March of their residency year, PGY1, PGY2, and what advice do you have for them to maybe set up some kind of expansion where they're working, or to justify their work there?
Yeah, absolutely. I have been successful over the last, few years from my prior institution to this one. I've added actually over 100 positions for pharmacists, technicians, new resident positions. So it's definitely within my wheelhouse. What I would say for the individual person is to get more engaged, learn these skills. I've seen many residents who during their residency identify an opportunity, and if they step up and write the business plan, justify it, many times they can create their own position when they're done. And it doesn't just have to be, you don't have to be in an admin residency to do that. You can be somebody who's doing any clinical residency. And if there's an unmet patient need, looking into that, getting more information, and then getting some coaching to help with the financial analysis, because that's still important to justify the position. I wish it wasn't, to tell you the truth. I think that's probably a whole nother tangent, but it does frustrate me that it's just not automatic. We have normal ratios of, we have 4 nurses or 4 patients to every nurse. We have 10 patients to every respiratory therapist. We have, 20 or so patients to every physician. But pharmacists, the numbers can be huge within a health system. And we need to be getting to the point, which I think we will, is it's automatic. Like if you have this patient population, you need to expand this service. It should just be automatic. And historically, what I've been seeing is we try to do more with less. And I think that's the challenge in the situation we're in. I know in different situations there's reimbursement issues, but there is money out there as we're moving towards value-based care. Health systems, individual doctors, they're getting paid based on quality. And that is where other pharmacy entrepreneurs like Blair Tiedelmeyer and the Metapreneurs team of Sue Paul and others, they're trying to help pharmacists to fill that gap on the outpatient kind of ambulatory MTM. I'm trying in my day job to add more pharmacists to, and have added more pharmacists to our ambulatory clinics, our inpatient areas. We've added technicians to medication history technician roles. But long story short is, be involved, be engaged, help solve the issues that your organization is having, and you will be able to create roles. The other basic things, of course, that are important are, networking, staying involved in developing yourself. Those cannot be overlooked either, because there are opportunities out there, and we do have to sometimes look beyond the traditional common ones. And most people get their positions through networking. That is definitely the number one way that people get positions.
I looked up the guy's name. It's Dominic Curry. He's a PharmD and BCCCP, so critical care and especially in burn. And he said something that I just couldn't kind of get out of my head. And as an administrator, maybe you can help me with this. But he said he created an Excel sheet, tracked outcomes for a month, and then said something about, so you're basically asking, is it a pharmacist or an MRI this year? Which is going to serve more patients, which is going to save or create more for the hospital. That kind of thinking is something that they probably didn't get in their IPPs and APPs and things like that. Can you help someone who's trying to justify a position based on their outcomes, kind of put that spreadsheet together, understand the hospital budget cycle? Because these are things that I would have absolutely no idea about. And to be fair, I was community the whole time that I worked in pharmacy. But can you help someone with those things? And then can you help the administrator who's maybe competing against other departments?
Yes, absolutely. And that's what I've done over the last several years. Admittedly, I did it in pharma too. I mean, I had to justify positions in pharma too. And I honestly did learn a lot of my strategic thinking, communication. When you're talking to those executives, you have to be speaking their language. And we can't be using the soft, nice things that sometimes we like to talk about as pharmacists. You do have to put it in their terms. So what are there important measures that they're looking at? And you have to tie your presentation and do it as a formal business plan with an executive summary and justify it. And I do think that the leaders in all of our organizations need to be assertive. We need to step up and continue to prove, and not prove, I hate to use that word prove, because we shouldn't have to prove, but we need to be engaged in communicating, because a lot of our leaders, the executive teams, don't understand the role of the pharmacist and how much they can help. So yeah, I can definitely help with that, and that's what I've been able to do with adding over these 100 positions. One of my strengths when I've done the strengths finders is definitely winning others over, so that skill does come into play, and that's kind of a natural strength for me. But I'm still very strategic about how I communicate, using strategic pitches so that over the 4 months before I actually present that plan, I'm actually planting the seeds with the different leaders to make them aware that there's a need or an opportunity here. So when I go to present that plan, it's not new. And they're like, yeah, we do need this. Let's see how we can fund it. And there's different ways of doing that. Sometimes it's the right thing to do. And I've definitely had that where it's the right thing to do. You need to add it. We are understaffed, under-resourced. We need to add those positions. But sometimes there are new initiatives, and you need to look for the various ways that we can tie the return on investment. But there is definitely ways we do it, because we can improve, the patient experience. That is very important to our healthcare organizations, and, even to the physician practices who are under these various, performance measures. We can improve associate engagement too, and the provider experience. Sometimes that is definitely harder to measure, but this is on the mind of all of our senior leaders. I know your blog, your podcast, and others have talked about burnout, and it's happening in pharmacy, but it's also happening with the physicians, and we can help with that. And so ideally, it's tying it back to the triple aim, what we're valuing, what we can do with both improving the quality, improving the patient experience, and ultimately we do reduce costs. So you may have to put that money up front for the FTEs, but you get that back through either more revenue, more savings, and improved patient experience. We'll tile it all together. So there's definitely ways to do it, but you have to speak their language and look at how you can tie that ROI back together.
So we're going acronym crazy with the ROIs and FTEs. So
sorry.
return on investment is the ROI, and then FTE. They actually talked about it on the episode that it's not full-time employee but full-time equivalent. I think exactly. is what it is, and it's talking to them in a way that they can say, okay, well, it's a body that we're paying X number of dollars, but maybe you could help our listeners understand the difference between justifying a position in pharmacy that is a dispensing position with very easy metrics to measure, and a position that is a clinical position where the metrics are not as easy to measure, and some of the impact is much further down the road than this month, next month, or even this year.
Yes, and it can be hard, and I've worked with many finance teams on this in my organizations. The tying it as much as you can back to real money is important. So readmissions, if you can reduce readmissions, if you can reduce an error that would have caused a longer length of stay, that's real money to the organization. So, for example, at Yale New Haven, when I was looking at expanding our medication reconciliation program by adding medication history techs with the goal, we had some, but we wanted to do all admissions with medication history techs because the data and our own data showed that was the right thing to do. We looked at our own data and knew that patients who had a safety event related to an admission error, it cost the hospital more money. So we did have to look at our own research with our own internal data to show leadership that, yes, this is real money. And when we reduce those errors through these med history techs, it covers it and then some. The other strategic thing that I would say I've tried to do is to combine business plans. I like to say that I don't like to waste ROI or return on investment. So when we have initiatives, for example, where we can, especially in the hospital setting, where we can control the drug budget, right? If we have and manage the formulary and use certain medications, make sure we're doing appropriate therapeutic interchanges and drug utilization, we can save on the drug budget. Well, doing that, you don't necessarily need a ton of positions just to do that part, but making sure you know that you can tie that savings to expanding all of your clinical pharmacy services, because they will help you to maintain those services. So combining ROI across multiple business plans, we were able to add positions in psychiatry, the emergency department, leadership positions, funded somewhat through the savings through managing our drug formulary. So there's a lot of different ways to do it. It's not all perfect. I wish it was all very straightforward.
Well, that's why you're there.
Admittedly. But I do think we're making progress. And, when I first came to my current institution and said I wanted to add 50 FTEs physicians, somebody thought I said 15. I said no, 50, 50, and I showed them why. And I didn't get all 50 with my first approval, but I got 32, and then I got another 12, and then we did the ambulatory business plan, and we got more there, and so it comes, and now I'm getting approval because we're showing that we're adding quality. Care is improved, people are happy, the providers are happy, so that makes leadership happy.
I think you're on a different level than most people can maybe conceptualize, because many people are thinking about, I need one job for one person and that's me, or maybe they're thinking I need two jobs, one for myself and one for my spouse. Where does this change? Because at some point something happened with you and your career that things changed from one or two people to all of a sudden many of the listeners are in leadership positions and they're thinking in terms of millions of dollars in budget, and they're thinking of many, many people. How does that transition happen, and then any best practices you can share?
Yeah, I mean, my transition definitely happened as I was taking on new leadership positions, broader roles that came with some of that. But admittedly, I like what Sarah White talks about. She, through a lot of talks and work on pharmacy leadership, talks about the big L's and the little L's. And so now I'm definitely a big L, but I always saw myself as a little L, and I encourage that in my team members. And so if I take it down a level, so again, going back to the resident who's working on a project, and I remember last year or a couple of years ago when we were working on a resident project, and we were looking at pharmacist role with the direct oral anticoagulants. And of course, we had pharmacists involved with Coumadin, but we didn't really have justified resources around the DOACs necessarily. And in general, anticoagulation clinics were going down. But while that resident was working on their project, I helped them to think through what were the resource needs. So don't just do the clinical evaluation that, yes, a pharmacist intervention will help and we can improve the safety. Take it to the next level. What are the resources necessary to do that? It's important to consider, can we stop doing some of what we're doing now and reprioritize this? So that was a good analysis. And again, that person now has those skills of thinking through, we want to do these new things. This might be what is needed, and this is how we can integrate it. We can optimize our role of the students. Sometimes our technicians can play a part. I always like to say, because I do believe in the American Society of Health System Pharmacists Practice Advancement Initiative, and through that initiative, many people talk about pharmacists practicing at the top of their license. And I think that's critical. I do think we have a lot of wasted time where pharmacists are not practicing at the top of their license. So we have to optimize the technicians' roles. They need to practice at the top of their certification, and we need to optimize technology, which is, of course, a big interest of mine as well. So thinking through those things, and again, developing yourself, when you go to do your growth development plan, your continuous professional development, make sure as you're growing and developing as a pharmacist, you're looking at things that aren't just the continuing education for the disease states and the clinical skills. Consider these other areas, because even as a frontline pharmacist, you can be justifying the needs for your group. When I first started as a clinical pharmacist, I justified then, I was a clinical pharmacist. I justified it, creating a specialist role where I would still do some clinical work, and it was a great position because I still rounded in one of the ICUs. But then that's when I took on more administrative responsibilities with the P&T committee. I still precepted, and I convinced the leadership again at that time to add another cardiology pharmacist. So you don't have to be in a leadership position. It's nice for me now, and that is what I focus on a lot, and I'm definitely passionate about it. But it doesn't have to start at the top. And admittedly, and some of leaders out there are not as assertive maybe as me, or don't feel empowered to do it, or maybe, and they don't. I do have had pleasure of working with some great leadership that is outside of pharmacy as well. But so sometimes it does need to come up. Managing up is a really good skill. And as new innovation comes, I know you have a lot of awesome listeners and people you've interviewed on this show that I'm like, these people are awesome, right? I would totally hire them, first of all. And they are also, driving the industry forward, and we need that energy and excitement. So they need to sometimes manage up and know that you may need to help your manager or the director to see the light of how we can be more assertive and help pharmacy to do more with more.
Okay. Well, tell us a little bit about how people can get in touch with you, or do you have any programs coming up that maybe they could participate in? We just had cast Randy Zuckerberg from Facebook, who's Mark's sister actually was just here at DMAC, and then Jerry Greenfield, who's of Ben and Jerry's. He just did his thing, and James Hansen, who wrote First Man, the story of Neil Armstrong. So these guys are all here in another campus just about 20 miles away, and I went to see them. And the first thing I thought was, I kind of want to see it again, or I want to hear more. How do people hear more about you?
Well, thanks, and thanks for asking. And so I do have a website, kimberboothe.com. I do film a weekly blog, and people can connect with me that way and share their email with me so I can communicate with them when those are coming out. I've also started a program, again, to tie this together and really focus on pharmacy. I've done other programs in the past, again, that were more general, called Connector Academy, but now I'm really focused on pharmacists. So my new program is called Pharmovation. And really why I came up with Pharmovation as a title is I just saw the need for, really combining pharmacy and innovation. We have this huge opportunity for pharmacists to have bigger careers, but also to expand our service to our patients to improve medication outcomes. So that is an online course, and people can learn more about that by going to kimberboothe.com /Pharmovation, and that will be launching this month, and they can stay in touch and learn more about that. It'll be conducted over about 8 weeks with various chapters and modules throughout that, courses with also weekly video call-ins so that I can answer people's questions as they go through the content, with the goal, again, that they will be able to help themselves have their own better career, but also that they can maybe help their whole department to expand pharmacy resources and the role of pharmacy.
So yeah, this thing around DMAC is called CI Week, Celebrate Innovation Week, and it's kind of a disappointment because it's just a week. And I really wish we had something like this where we could kind of have more of an extended time to kind of say, all right, well, that was cool. Let's talk about this person, and then let's talk about the next person, and kind of. And I understand you when you're booking our speakers, of this quality, you put them all in a week, and you put it in that way. But what I'm more excited about is the longitudinal way that you're doing this. So does it work in such a way that somebody has to start on the day that they start, or can they start at a different time, or is it rolling? How does it work exactly?
Well, this program, so that I best support the students as they're going through it, it will be kind of launched and organized at certain times of the year. So, this upcoming will start in April, and that group will go through over the 8 weeks again, so that those weekly calls can be coordinated for them. But then there will be an online community for people to stay in and be involved with. And then I'll launch the course again in August. But that's the way I decided to do it. And when I've done other online programs myself, whether it's in pharmacy or in high performance, I have enjoyed when it's a kind of a facilitated conversation like that. So that's how I'm doing it. They can always come in and sign up and learn more and participate in some of the other programs. And there will be an online, community with the group for ongoing conversation even after the 8 weeks. But I did decide to make it a focused time so that people are all starting at the same time for that each core group that's going through at that time.
Okay. Well, I've asked you a bunch of questions. Is there anything that I missed or anything that you want to say that I haven't covered?
No, I really appreciate the opportunity, and it was great to be able to talk about these opportunities in pharmacy and share my thoughts. My final thought, and actually my word of this year is bold, be bold. And so I really would just encourage everybody to, be bold, be innovative, and really to be accountable for the medication use process. Pharmacy really is the answer, and we can do more with more. So,
Sounds good.
Thank you so much, Tony.
All right. Well, it's Kimber Boothe, and there's an E on the end of that, so KimberBoothe.com if you want to get in touch with her or see her material. So thanks again for being on the Pharmacy Leaders Podcast.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.